Hello guys, welcome back again on my YouTube channel. Today I would like us to discuss on this eye condition called refractive error. Okay, refractive error is an eye disorder that prevents the eye from focusing light on the retina, and so thereby making images to appear blurry to a patient. Now there are so many types of refractive error. The very first one is what we call myopia. Myopia is commonly referred to as nearsightedness or short-sightedness. Now, for this patient to clearly see, the patient cannot see at a distance. The patient sees only images that appear closer to him or her. And with this condition, there are so many complications that can lead to it. The very first one is the patient cannot see far objects, but the patient see only near objects, thereby making life difficult for this patient to kindly carry out activities that are related to distant objects. Also, we have this other refractive error called hyperopia. Hyperopia is long-sightedness, okay? Long-sightedness, meaning that this patient is only appreciating objects that appear far away from him or her. But when they come closer, this patient will be unable to really appreciate the objects. And with this situation, it still makes life difficult for this patient because the patient cannot really access objects that are closer. And so, with this condition, it can be corrected. Not that it cannot be corrected, it can be corrected, and there are so many ways that can be corrected. Also, we have this refractive error called presbyopia. With presbyopia is vision issue that is related to age, meaning that the way that you were seeing at your 20s, you can no longer see at the age of 40 years and above, especially when it comes to characters, especially when it comes to letters that are minute, that you cannot see them well. And so with this issue, it is related only to those that are at least 40 years and above, and is age related. Don't forget, it is age related. And so if you are at the age of 40, then the letters that you could see at the age of 20 clearly, and you cannot see them at the age of 40 clearly, know that there is an issue. You need to visit the hospital so that that issue can be corrected. There is also what we call astigmatism. With astigmatism, for light to focus on the retina, the focal points are so many that it causes a lot of problem to this patient. At times, the shape of the cornea also has a lot to gather light for it to be focused on the retina. And so when the shape of the cornea is not the accurate shape of the cornea, and when light reaches the cornea, now the light will flashes. Now the focal point of this light will appear severally, and thereby causes a lot of symptoms. Now when it comes to symptoms of refractive error, you will find this patient saying that I'm having headache, I'm having nerve pain, painful eyes. Even when looking at the light, I feel so much pain. Yes, these are strenuous activities that can trigger these symptoms. Yes, this strenuous activities, some of the strenuous activities that you can have with refractive error, those are read too much. Those that uses computer oftenly. If you use the computer oftenly and thereby not making sure the light of your eyes could accommodate the light of the computer, it will causes eye strain. Which at the end of the day, it will bring you a lot of problem. Some people will also have nerve pain, painful eyes, headache. In fact, these are the symptoms. When you find yourself wanting in this kind of symptom, know that there is need for you to visit the hospital. Okay? For the diagnosis, what the doctors they do is that they carry out what we call refraction. With this refraction, they carry out refraction, they do retinoscopy. Yes, with this they'll be able to identify which refractive error has been a threat to your vision. And by so doing, in most cases, in terms of treatment, what they do is that they give glasses, corrective glasses. Those for long-sighted, they will give glasses that will be able to correct their condition, and those for short-sighted, they will also give glasses that will be that will correct their situation. And for those for presbyopia, they will also give them lenses that will help them appreciate the characters that appear before them. And so doing, with this, it will help to solve your problem. And so if you find yourself in any